Basic first aid. Let's say your friend gets a deep cut. What do you do to stop the bleeding? The pressure trick. The point is to apply pressure with whatever you have handy, a piece of clothing, even your hand if needed. If the bleeding doesn't stop, elevate the injured part above heart level to slow the blood flow. But what if someone trips and falls, and maybe have sprained or a broken bone? You do two things in that case. You do not move the bone, and you do something to keep things stable. Look around you for sturdy, straight object, a stick or a rolled-up magazine. Wrap it gently but securely to the limb with a scarf, belt, or even shoelaces. This simple hack can minimize pain and prevent further injury until medical help is available. And what do you do if you find someone unconscious? This is when we talk about recovery position. On their side, with one arm under their head like a pillow and their other knee bent to stop them from rolling over, this helps prevent choking if they vomit, which is common when someone is unconscious. At last is the ultimate lifesaver, the CPR. If someone isn't breathing, push hard and fast on their chest, around 100–120 pushes per minute. Think of it this way. Every push is like a manual heartbeat that's keeping oxygen flowing to the brain until help arrives. Extinguishing fire. Let's say you're in the kitchen and suddenly a small fire flares up on the stove. What's the first thing you do? A lot of people tend to pour water on it, but that's the worst thing you can do actually, because if you do that, this happens. So in order to get rid of the fire, you must get rid of the oxygen. The best way to do that is to cover it up with something of steel. And that's it. Remember, never use water on any fire that includes oil. Water definitely works for many domestic fires, just not for oils and anything electric. The second way you can get rid of a fire is by using an extinguisher. It's very simple and anyone can do it with this technique. So P is pull, A is for aim, S is squeeze, and S is for sweep. If you remember this technique, you can easily use a fire extinguisher if needed. Reports show that there are 12,000 home fires annually in America, and 75% of them start in the kitchen. So be sure to cut off the oxygen, or use a fire extinguisher, probably an F-type. Heick Maneuver. Let's say someone starts choking in front of you. If you just stand there and do nothing, the person might die. So you step in and do the Heick Maneuver. If you do it right, you will very likely save a life. Step 1. Stand behind them and wrap your arms around their waist. Step 2. Make a fist with one hand and place it just above their belly button, below the rib cage. Step 3. Grab your fist with the other hand and press in and up with a quick, strong motion. Think of it like you're trying to lift them off their feet with each thrust. Repeat this a few times until the object pops out, or they can breathe again. Remember, don't hit them on the back while they're standing. It can make things worse by lodging the object even deeper. But what if it's a baby or a child? In that case, you'll use 5 gentle back blows or 5 chest thrusts. And if you ever find yourself choking and there is no one to help around, use any object and get the Heick Maneuver going on yourself. Handling electrocution. Let's say someone's accidentally been electrocuted. The first thing you need to do is to cut the power. If you can't find the switch, turn off the main power of the house you are in. In case you can't turn the electricity off, find something wooden, rubber or plastic, anything that won't conduct electricity, and use it to push them away from the source. Once you've gotten them away, check for their pulse and their breathing. If the person is breathing and unconscious, put them in the recovery position. If you can't find the pulse, start CPR immediately. Ask someone to call 911 so the help can arrive on time. Handling heart attack. Every year, more than 800,000 people become victim of a heart attack, and around 14% of them die. So what would you do if you see someone having a heart attack? Very first thing you do is call 911 because time is very critical in such situation. Until the help arrives, encourage the person to sit down and lean slightly forward. Next thing you do is that find the inside part of their elbows where the artery runs. Strike that area firmly with your fingers. This is an effective way to stimulate blood flow until the help arrives. Another thing you can do is use this. This is an AED and is used to deliver a shock to restore a normal heartbeat. It is generally available in all public places, like schools, offices, banks, or even gyms. Here is how you use it. Turn the machine on and attach the pads to the victim's chest. The machine would analyze the heart rhythm and will either give the shock to the victim itself or ask you to press a button to make it happen. Anyone can use it, even without medical training. If the person goes unconscious and you can't find AED, then of course the last resort is CPR. Dealing with a stroke. Stroke happens when blood flow to a part of brain is interrupted and brain cells begin to die due to lack of oxygen. The worst part is that if not catered timely, It is fatal or may cause permanent disability. The best thing you can do is identify that a stroke is happening and call for medics. We use the FAST method to remember the most common signs. F is for face. Ask the person to smile. If one side of their face droops or seems lopsided, that's a red flag. A is for arms. Ask them to lift both arms in the air. If one arm drifts downward or they struggle to lift one side, that could signal muscle weakness, another common stroke symptom. S is for speech. Talk to them and listen carefully. Is their speech slurred or jumbled? T is for time. If any of these signs are present, act fast and call 911 immediately. Low blood sugar. People with diabetes are the ones who would experience low blood sugar levels. Symptoms include feeling shaky, lightheaded, sweating, or even blurry vision. Now, if you are with someone and they tend to have these symptoms, here is what you can do. Give them something that would boost their sugar levels instantly, like juice, soda, candy, or anything sweet. Wait for 10-15 minutes to see if their symptoms begin to resolve. If not, give them another dose of fast-acting sugar. Once they feel better, consider giving them a small meal to stabilize their blood sugar. Remember, if you find the person losing consciousness, call emergency services immediately. They would have to use a glucagon injection kit to raise their blood sugar quickly. Treating severe burns. Imagine you're cooking, something goes wrong, and you end up getting a serious burn on your hand. Here is what you do next. You need to cool the burn down. Put your hand in the running water for at least 10 minutes. This would reduce the pain and minimize skin damage. Don't use ice, it may worsen the skin damage. Next, you want to cover the burn to protect it from germs. Using a plastic wrap would be a best option since it is easily available. Remember, do not use any cream or toothpaste since it would trap the heat and increase chances of infection. And if the pain is too much, take a painkiller to help yourself. Additionally, do not pop blisters, avoid tight bandages, and definitely seek medical attention. Low or high blood pressure. Low blood pressure is also referred to as hypertension, and its symptoms are dizziness, fainting, blurred vision, and weakness. Here is what to do if someone experiences low blood pressure. Have the person lie down and raise their legs above heart level to help increase blood flow to the brain. Encourage the person to drink water. Adding a pinch of salt in it would be helpful. In case of high blood pressure, the symptoms include severe headache, shortness of breath, and chest pain. In hypertension, encourage the person to relax and control their breathing. The point is to lower their heart rate, which would ultimately reduce their blood pressure. There is 4-7-8 technique that can be used. This involves inhaling for 4 seconds, holding your breath for 7 seconds, and exhaling for 8 seconds. This method can help slow the heart rate, calm the nervous system, and potentially reduce blood pressure. Remember, if the person has prescribed medication for it, they should take it as directed.